Well, tomorrow marks the last day of National Suicide Prevention Month, but for one tri-state community in particular, the fight continues. In 2022, nearly 50,000 Americans lost their life to suicide, and according to the CDC, overall suicide rates are at an all-time high. In Shelby County, Missouri, the same alarming trend, but now an effort to research and study in hopes of reversing that trend. Shelby County, Missouri is a taste of small-town USA, having only 6,000 residents total. Some roads can go several minutes without seeing a single car. It's filled with buildings of businesses that used to be a place where farming reigns supreme.
We've had 21 suicides since 2010. 6 of those suicides have been in the last 2 years.
But behind the Americana that makes up most of the Midwest, a growing problem. In 2022, Missouri ranked in the top 30% of all states with the highest suicide rate, according to the CDC. In Shelby County alone, 21 suicides in the last 14 years speaks for itself. That's nearly 2 deaths by suicide every year.
It's such a small community that we are all so impacted by each one of those lives lost.
Jolie Foreman is the co-director of Shelby County Cares, the only mental health facility in Shelby County. It launched after the county received a suicide firearm prevention grant last year. Foreman and the organization's therapist Lily White are together studying the correlation between high suicide rates among local farmers. Both of their husbands are farmers, and Foreman has had several family members die from suicide who were farmers. They believe it could be external factors leading to the alarming numbers.
Not being able to control the weather, not being able to control the market and the prices.
They describe their research as boots on the ground work, going directly to impacted families and other farmers.
How can we support that family unit, ultimately supporting the farmer themselves?
According to the CDC, suicide was a top 10 leading cause of death in Missouri in 2022, behind kidney disease and diabetes. While the facility itself is still a work in progress, White is taking clients, and already they're hosting mental health first aid workshops. As Foreman keeps checking goals off her list, she one day hopes to expand to surrounding communities.
I feel like we're all kind of in it together, where we're trying to raise the family and support the husband that is trying to do this amazing job of providing food for our whole country.
And while their initial focus was on farmers and suicide, White says she's seen a newer trend locally where more children and teens are trying to end their lives. We have contact info for Shelby County Cares on our website, WGEM.com.
Now.